Hi everyone, this is Alex Theodorou, and you're listening to the Startup Sit Down. Hi everyone, this is Alex Theodorou, and this is the Startup Sit Down podcast. I am joined today with Dr. Caitlin Strobel, an awesome occupational therapy professional with her doctorate in occupational therapy. And we're going to talk about all things health related and research and all that fun stuff. So we've had some great conversations in the past, and so we're very excited to have her here today. Thank you, Caitlin, for being here.
Hey, Alex, thanks for having me. So excited to get to it, chat a little bit more about what's going on.
Perfect. Yeah. So maybe just to kind of get started, would love to learn a little bit more about you. Maybe tell us a little bit about your journey to becoming an OT.
Sure. So I would have to say that, like you introduced, I am a neuro rehab occupational therapist going on 3 years of practice this summer. Um, and like many other industries and professionals, the COVID-19 pandemic certainly catapulted the rehab profession, as well as the entirety of our healthcare system, into the digital age, whether we liked it or not. And so since 2020, after a couple years of practice, I've been trying to embrace the change by actively engaging in the digital transformation of our profession through the transformation of my own practice, in order to usher in a new era of OT over or since um, a century later after its conception. But in terms of getting to where I am now, engaging in healthcare technology and new ways of treating our patient populations, I had a bit of a traditional trajectory in that I knew I wanted to become an occupational therapist. And so I sought out my OTD program in undergraduate, in attempts to kind of be at the forefront of our profession in that OTDs just had a little bit more opportunity in for advancement and leadership opportunities within the field. So I went for it. I had a wonderful experience at Washington University in St. Louis, go Bears. And I really just tried to engage in as many different modes of practice and of education and program development as possible in order to really diversify my practice and my professional skill set. And so that looks like a multitude of things in terms of being involved in our student run pro bono clinic, actively engaging in my clinical research project as the sole investigator on my dissertation, and as well as being head of our advocacy committee. And so being an advocate for our profession in different healthcare spaces and in front of other professionals. So here I am in terms of yeah, moving forward and just learning from others and from what this digital age is trying to teach all of us.
That's incredible. No, that's absolutely incredible, and I'm so glad that we connected, to be honest, because I think it's surreal how interconnected this community is, and we actually, interestingly enough, this also happens to be OT Awareness Month, so that is also
Yes.
another awesome part there as well. So maybe tell me a little bit about, like, did you always know you wanted to become an OT? Like, it's such a it like you know now, at this, age and this part of my life, now that I'm aware of kind of like the different healthcare professions, I feel like OT is one of those professions that it has a lot of flexibility, has a lot of versatility in terms of what you're able to do, how you're able to help people, specializations. And so, like, tell me a little bit about, like, how did you, like, what drew you to becoming an OT professional? Or was that always the original choice?
That is a great question. And I think alongside you, I have been learning in terms of the diversification of our profession and what opportunities are out there outside of direct clinical practice or traditional models of care. But it has been a nonlinear path for sure, in that I went into my program wanting to become a hand therapist. So, traditional outpatient orthopedic care, and that I'm very science minded. So I think that knowledge really excited me and propelled me. But what I think drew me most to the profession, and what I think a lot of people are discovering about themselves as well, is the ability to be a creative problem solver. So every single day, we have to handle new barriers, new issues among a diverse patient population. So you're not always dealing, with the same, barriers to engagement in their activities, or, engagement in the community, or with their families. So you just have to stay on your toes. And I think being able to exercise that element of creativity in a professional space, outside of our traditional purview of, what creativity means in terms of creating art, or, products, or now content in today's digital world, is what really is most exciting. And so being able to take those soft skills for creativity, for problem solving, for people skills. If you can't tell, I love meeting new people every single day, and obviously this profession allows a broad breadth of being able to do those things. Is what really excites me and drew me to the profession. And like I said, I'm just learning
Mhm.
new ways um, to be able to implement those practices, whether that's being an advocate for our profession within the innovative healthcare technology space, whether that's working on grants and projects for nonprofit organizations, supporting community engagement in health and wellness initiatives. Just, the list goes on and on and on. I could sit here talking all day about ways that we do that. But for me, number one, it's creativity and problem solving. And I hope to be able to carry that into the future of my career.
That's amazing. That's absolutely amazing. No, and well said as well too. Um, so maybe tell us a little bit about where do you see the role of innovation in clinical practice and beyond? What is the future of kind of innovation in your space look like? Is there anything that it might any sort of forms it might take, anything that's being done right now? What maybe comment on that if possible.
Sure. And I think that's something that's most exciting. Obviously, I've alluded a lot to that in terms of the rise in healthcare technology, and maybe because I'm engaging in it a little bit more so. And so it's, more at the forefront of my mindset and professional development. But at the same time, like I mentioned, COVID just really catapulting us, 10, 20 years into the future, into where we had to solve some very acute problems. Um, with technology, through the immediate implementation of virtual care platforms, and transitioning our patient caseloads over to those in the immediate throes of the pandemic back in March, April of 2020. And so I think, innovators in this space, investors, and patients and providers alike have all caught on to this. And so I see this huge rise in digital therapeutics, in digital health products, in integrative virtual platforms, for telehealth, for health coaching, for patient education, and other realms that can help solve some of these barriers to access to care, and barriers to continuity of care that we really saw, just that the COVID-19 pandemic really shone a light on.
Yeah.
And so, through this rise in digital therapeutics, we're also seeing a rise, or just kind of an increased want and need for wellness models, versus our traditional sick models of treatment, and of care that exist within our current system. And these models really emphasize prevention and self management, for our patient populations that we typically see in the rehab space.
Mm.
where they're dealing with, chronic conditions, chronic diseases, long-term disabilities that continue to impact their life out, following the acute phase of injury or onset. Um,
Right. Right. Right.
and so within the rehab and healthcare and health coaching professionals or professions, um, these people are, are gravitating towards these places as well. In that obviously our patients are gravitating towards it, and that whether they're tech users, they have an increased ease, they have increased access to care. But also our providers can enjoy, just a more optimized work experience, and that it can
Mm.
be more flexible to meet their family needs. Their personal needs as well as, their professional needs, for being able to grow their practice in
Mm.
non-traditional ways.
Right. 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 That's wow. Yeah. No, absolutely. And I think you kind of packaged a lot in that comment there, and
Oh
I
yeah,
love it. I think it's definitely something that is very fluid. It's a very kind of there's a lot more that needs to be done, and I think we're really just scratching the surface. And I think you kind of um, made that very clear that that there's you know there's a lot of work here in this space, and it's I think we're all just kind of doing our part to really move the needle in some way, right? And so no, that's wonderful. Um,
yeah, in a very
yeah,
long-winded way, commented on many things, but yeah, like you said, just scratching the surface, but us needing to dive deep in a short period of time. But
yeah,
I hope it'll just continue to expand and grow. These seeds that COVID and I
yeah.
think just a new era have kind of planted recently.
Absolutely. Yeah, and I think that's a big thing too that, we often hear is that, COVID has been like a catalyst in many ways, but it's also been a new frontier in that it's opened up a lot of new ways of thinking. It's kind of pushed professionals outside of their comfort zone in many ways to go from a much more um, you know, well documented like pen and paper method to saying, well, maybe we could embrace something a little more digitized, or how could we embrace something like technology and innovation in kind of the clinical space, right? And while that might not be kind of adopted 100%, I think that we've learned a lot, and we learned kind of what you know care and how healthcare delivery can be, and how that we've kind of you know we haven't I guess you could say, maybe this might be a little bit rough around the edges, but like we haven't left people slipping through the cracks in as many ways with these kind of new digitally enabled solutions, right? Or just ways to kind of think more creatively. And as an OTs are some of the most creative people I've ever worked with, just in the ways they use both our product, the way they kind of engage with patients in a much more personalized, individualized way, thinking of how we can, how the profession can create goal-oriented kind of objectives that really move people towards what their focus is in life, and how can you break this down into like actionable chunks of kind of I guess you could say activities, tasks, things like that, right? So no, you're absolutely right, and
Absolutely.
it's wonderful. And so I guess to kind of switch gears for a moment now, what do you think are some of the challenges that you may envision or may have seen to date with technology in patient care? Is there anything that kind of you might have thought that still needs a little bit of work or might be a little rough, kind of, in some capacity right now? I'd love to hear about.
Absolutely. Just with any innovative product, technology, having its upsides, I certainly see the value, like you mentioned, and being able to bridge, care gaps for, our rural-based communities, optimizing patient outcomes, promoting that continuity of care, etc.
Mm.
But there are certainly downsides, and we see and live this every single day, for therapists, within the clinical practice space, and just the barriers, the very tall barriers that we have to overcome in order to try to integrate this into our practice, to get key stakeholders and decision makers on board with what the research is saying. And even being able to decrease the runway or the timeline that it takes for clinical research findings to reach practice guidelines.
Yeah.
And so there's a lot of work being done in terms of trying to address some of those challenges.
Mhm.
And I mentioned a couple, basically being the disconnect between some of those stakeholders, especially within large health systems, to no fault of anyone's own, but just based on the sheer volume of the organization.
Yeah.
The time and training that it takes to get your clinicians up to speed on its standardized use in order to make the best use of that technology.
Mhm.
Even the system and facility capacity for being able to pay for that technology, and that we're talking about a wide range here from low tech solutions, all the way to extremely high tech, that, only large scale health systems may have access to financially.
Yeah.
And then also, I certainly see a barrier for my patient's capacity to be able to use technology. In that being, especially for my neuro-related illnesses,
Mhm.
those with mental, emotional, even social barriers to being able to, sit down, maintain attention for a telehealth session,
Yeah.
being able to, appropriately problem solve for the use of that, using it independently, or if they're having to integrate, online virtually somehow with their clinician in a different location.
Mhm.
So I'm kind of rambling about a lot of challenges, but in terms of trying to overcome some of those, we've seen some work being done in terms of use of the knowledge translation strategy. So kind of, an innovative piece of integrating clinical research into practice, in that um, they are putting therapists on clinical research teams in collaboration with them to become standardized users of the technology, and basically training the trainers so that they can go back to their teams and help
Mhm.
to support and train their fellow coworkers on that technology, and to be the go-to person for questions and answers, which you mentioned being can be a huge barrier depending on people's comfort level or,
Right.
willingness to adopt technology.
Yeah. Wow. Yeah. No, absolutely. And no, great response. I appreciate that. Um, so I think kind of you know, I've always had the kind of, you know, thoughts about, where potentially the future of health and wellness is from an OT perspective. Is this something that you've kind of given some thought, or I know we talked a little bit about the role of innovation, but what does the delivery of care, or like what does the role of an OT look like? I guess you could say in, a few years or even 5 years from now. And what do you think are some shifts that might be happening uh, currently that you're thinking might enable us to get there?
Yeah, super good question, and something I've thought about a lot. I feel like we've just been kind of in fight or flight mode,
Mhm.
as a world, as a country, as a profession, just in trying to address some of the acute challenges that COVID brought along. But in terms of kind of peering behind the curtain about what the future looks like,
Mhm.
I would say occupational therapy will play a significant role, um, in the fact that us being a little bit, creative, non-traditional,
Yeah.
kind of forward thinkers. I just kind of see this as kind of the makeup of our profession. Um, and that amongst us, I kind of see us re-entering these non-traditional practice settings, and that at at our profession's conception, we were within the mental health space. And unfortunately, we've seen our presence within those spaces decline just based on,
Yeah.
our traditional reimbursement models currently. But I see a drive and I see a want and I see a need for our profession within community based settings, whether that's within patient homes, community and wellness centers, mental health centers, um, in that we are really advocating for ourselves in these spaces. And that was kind of, what we chatted about, the diversification of this profession, that there's a lot of options to translate our skills to, really emphasize our value in terms of how we can have an impact on organizations and our patients. And so it's really exciting, and I hope that similar to you and other innovators, take the leap for something that feels a little bit less comfortable, for something non-traditional, because that is the forefront of innovation, and that's going to help drive the need as well as outcomes for our patient and community populations, in order to just expand the breadth of our reach.
Certainly, certainly. And I couldn't agree more. I think that was very well said. So I think that brings us to kind of, this portion of the podcast where we'd love to kind of, maybe for people who are interested and, love what you're talking about, maybe want to learn more, how can people get in touch with you? Is there anywhere we can find you on social media or anything that's new and exciting happening on your side that you'd love to share and showcase with
Thanks.
our listeners?
Yeah. Thanks for asking, Alex. Absolutely. So currently my platform is LinkedIn. People can find me under my name, Caitlin Strobel, occupational therapist on LinkedIn. And I hope to have an update here soon regarding my new blog and website, that will showcase kind of my own entrepreneurial spirit for transitioning into self-employment, and being a personal OT to members of my community. And I'm a big health and wellness advocate, and so I'd like to share my perspective on that platform for promoting that in different realms of everyone's lives. So coming soon, there are many. There are the orange construction blockades around that right now.
Amazing, amazing. Well, I'm so glad that we met, and thank you for the wealth of knowledge and perspective. This has definitely been refreshing and eye-opening at the same time to learn about. And I think, we need more kind of champions like how you're approaching kind of the role of innovation in care. Just kind of lending your voice to kind of showcasing kind of what's out there, but also really taking that leap as well too, and working in the forefront of what healthcare could be and how can we work towards this growing and evolving needs in supporting individuals, and how can we do that through the lens of an occupational therapist. So thank you so much, Caitlin, for your time and amazing perspective, and we look forward to learning more from you soon with your content and your contribution to the field. And thanks again for coming in.
Absolutely, Alex. Thanks so much for having me. Glad I can be an advocate for OT. Happy OT month, everybody.
All right. Thank you. Bye.